This Sketchpad video is the first in a series from Training Great Minds that will provide clinicians and patients with the psychological skills to take control of persistent pain. These videos will help you to understand pain, particularly the part that your brain plays in the experience. And the first thing to understand is that pain is complicated. If it wasn't, it would be easier to treat. But the fact is that 1 in 5 of us is experiencing a condition of persistent pain. One of the big complications is that two people with exactly the same injury and exactly the same level of damage can experience completely different levels of pain. So why is this? Nerve endings around the body are on the lookout for danger. And when they find it, they send signals to the brain to let it know what's happening. The damage information is picked up by cells called nociceptors, a word that comes from the Latin nos, which means to harm. The whole process is called nociception. So when these signals reach the brain, they pass through a structure called the thalamus, a kind of sorting station that forwards this information from the body to the regions that need to know about it. These regions process emotions and thoughts, they coordinate actions and behaviours, they interpret physical sensations, they plan suitable responses to the information. And all of this together gives us a unique pain experience. If we go back to the beginning for a moment, we can think of the information contained in these signals as damage reports that provide information about where the damage is, how much damage has been done, the type of damage. And once this damage report gets to the brain, these regions communicate with each other in deciding how much pain do I need. Remember, pain is complicated. We tend to assume that when we have high pain, we must have high damage, but this isn't true. Sometimes we can have high damage, but the brain decides on low pain. And sometimes you can have low damage, but the brain says high pain. For example, imagine you have back pain, but you come across danger. Your brain will very quickly send signals down to block the information coming up from your back so that you can get to safety. And once your brain knows that you're safe from this danger in your environment, it allows these signals from your body back into your brain so that pain can be produced again. If you have persistent pain, it's also likely that you have anxiety or frustration. You might worry or be sad. You might even be angry. And your thoughts are likely to match the emotions. Some people think about how they'll manage at work, or they wonder if the pain will ever go away. We've all said, this pain is killing me. And we wonder why we can't get rid of it. And all of this is perfectly natural. But this response means that signals from your body enter a brain that's on high alert. And these signals now have high threat value. So your brain responds by turning up the volume of your pain. A key point is that you now have two targets for therapy. Your injury can be targeted with manual therapy that changes the content of the damage reports, and your brain can be targeted with psychological skills and techniques such as cognitive behavioural therapy and hypnotherapy that will reduce the threat value of this information and turn down the volume of your pain. So what are the take-homes from this video? Your body produces damage reports, not pain, and sends them to your brain. Your brain quickly assesses their threat value. Everything up to this point is called nociception, not pain. A brain on high alert produces pain. Psychological skills training gives you control of your pain. The answer to persistent pain then is to complement physical therapy with psychological therapy. Until then, stay active and stay positive. For more information, go to www.traininggreatminds.com. Feel free to like me on Facebook and look out for future Sketchpad videos about psychological skills that will help you to take control.